Hi, my name is Debbie. I'm 61 years old and I'm using cannabis to treat chronic pain and to reduce opiates, plus other health conditions. But we'll talk about chronic pain and opiates right now. In November of 2015, I went to a normal doctor's appointment and he informed me he would no longer be providing me with my prescription for OxyContin, something that I'd been receiving for 15 years without question or concern, to treat chronic regional pain syndrome. And he told me this was just strictly due to an office policy change, that they had just decided as a group that they were no longer going to be providing pain medications for anyone. So he handed me a list of references, sent me out the door. He said he didn't know who might help me. He had no suggestions. And I was really confused. I didn't realize how confused I was going to be until I started trying to find a doctor to help me. I made an appointment with that doctor on the pain list, the pain clinic, the one he recommended most. And as I'm sitting in his office in my wheelchair on oxygen in the middle of having a lung infection, unable to breathe on my own, unable to walk across the floor, he looks down at me and I look up at him. And he says, "You can go into detox today, detox off all of your OxyContin in 1 week. We'll put a spinal cord stimulator in your back, and you'll start on methadone and you'll be on it the rest of your life." I said, "Excuse me, I'm sorry, you must have me confused with someone else. I'm just here because of an office policy change. My doctor just decided they no longer were going to be providing pain medication, so I'm coming back to the pain clinic." He said, "No, you don't understand. You have to get off all of your opiates and you need to do it today." Well, no, I didn't understand. I didn't understand why I needed to do this now. Why was it so important in the middle of a serious lung infection that I reduce all my opiates? There were no reasons. It was of no fault of my own. I was being pushed here. I knew that I couldn't do what he was asking. Not something I would even consider. Not something that my lung doctor wanted me to consider. She didn't want to put my health in that risk. He never even asked once why I was sitting in that chair or why I was on oxygen. There was no consideration for my health conditions, and I had no idea and understood why, but I didn't have time to find out why. I needed to find someone to help me with my prescriptions. Because, see, they were going to run out soon. When you have a prescription of OxyContin, you can only get it a few days before it runs out, and you can only get a month's supply at a time. So it's not like we have a lot of choice and a lot of options to do it in a very quick fashion. It's not like we can wait 90 days and we get another dose. I was terrified. I didn't know what I was going to do. It was disruptive. In the middle of being so sick, I'm trying to figure out how am I going to do this. And every doctor I called, I kept getting the same response. "You're on too high a dose. You need to get down." See, I was at 240 milligrams a day of OxyContin. And that's the only thing that was allowing me to get my pain level down to a 6 and even allowing me to live with my family and function and have some kind of normalcy. It's like, well, if I can't, and they kept saying, "Let's just get down to 80 milligrams and then we can help you. We can't see you till then. Just get down to 80 milligrams. Well, excuse me, how am I supposed to get down to 80 milligrams if no one wants to give me a prescription? I'm just really having a hard time reconciling this, and no one could explain that to me. And they kept saying, "Well, I don't really know, but we can't help you." So I knew I had to figure out something else. That wasn't an option. Because everybody had always told me, "You can't just stop OxyContin. You can't just stop it. It'll kill you." Well, you know what? I believe you when you tell me that, and I'm not willing to test the system to find out. I'm really not one that does that. When you tell me something, I follow the rules. Well, I was fortunate enough that I was seeing another doctor for another health condition, and he told me he had heard of a group that was starting a new study to see if that cannabis could work with chronic pain, because I live in Arizona, a medical marijuana state. They accepted me, and they found me a doctor that would provide me with my prescription of OxyContin as long as I agreed to cut down and taper off and get off of all of it. Well, what choice did I have? I didn't have anybody else offering me anything else. So, of course, I said yes. And my journey with cannabis began in December of 2015. And no, it hasn't been easy, because I had to figure out how to do this on my own. I mean, the clinic that was running the research, they didn't know. They kept telling me, "Just go to the dispensary. Someone there will be able to help you and tell you what you need to do." I wish it was that simple as you just go get a joint, take it home and smoke it, and it fixes everything. It's not. It takes time to figure out which strain works best for your health condition, whatever it may be, that you're receiving the best benefit. While I'm trying to figure this out, and while I'm struggling with this lung infection, I developed the flu. Next thing I know, by February, just 2 months into this process and still having nothing figured out, and pain like I can't even describe, well, I can describe it, but it's not something you'd understand because it's the most excruciating pain in the whole wide world. But the thing I can tell you is I found myself, I couldn't breathe. I couldn't breathe. I was laying in a hospital bed fighting for my life, trying to figure out how to reduce opiates in the middle of a lung infection, trying to figure out how to use cannabis. I had no clue. And nobody cared. Well, I can't say nobody cared. The hospital helped me as much as they could. I couldn't even tell them what I was going through. I didn't trust them. I already had so many doctors tell me they couldn't help me. What was I going to do if they found out I was trying to use cannabis while I was dealing with all this? Were they going to refuse me? I don't know. Were they going to take my opiates away? That's exactly where I was. I was afraid I was going to lose everything. And then I would die. I laid there and fought with everything I had because I still want to be here. I didn't know how important that fight was. I do now. Because of that fight, I'm here. I'm able to share my story. I'm able to be here to make sure that no one else has to lay in that bed and suffer and fight for something like I did. There's no reason that anyone should be struggling with opiates today when cannabis can help you, because I can sit here right now and tell you that I used to be at 240 milligrams a day of OxyContin, and I'm now at 50 milligrams a day, and I live in less pain than I ever lived in while I was on 240 milligrams. The other thing is I was told you'll never be able to reduce below 120 milligrams. It just won't happen because of the kind of pain you have. Well, they don't know. I'm sitting here at 50 milligrams a day, and I'm still going to taper down more, I hope. We don't know. They don't know. The doctors have no clue. They're just, I don't know what they're doing, but they're not involved. You can't even get a doctor most generally to accept that you would even use cannabis to try to get off of opiates. But I'm doing it. And I've never wanted to go back up. I've never taken an extra pill to deal with some pain because my pain is dealt with better now than ever. I'll tell you, getting through a taper down is hard. It's not easy because your body goes through things because your body is dependent upon that medication. It's been used to receiving it. So it doesn't like it when you're cutting it down. But it's not that horrible because cannabis makes it easier, and once you figure out the right strains to use and you can find them, it's a whole lot easier than trying to do it without knowing that. And that's why I'm here sharing my story on effective cannabis, so that people can see how important it is that we have medicine for specific health conditions so that we can treat it, and so no one has to go through this again. There's no reason anyone should be suffering or dying today when we have an option of cannabis. It can do both, control pain and reduce opiates. And I hope you see how important it is that we do this and that we make sure everyone has access. I'm really glad I got to share my story. If you have any comments or questions, please be sure and send a note. I'm welcome to answer any questions. I'm ready to share exactly how I've used cannabis to reduce opiates and how I've used it to control my pain, what strains I'm using. I can't wait to share all of that with anybody that's using cannabis today to do the exact same thing. I hope you have a wonderful day. Thank you. Bye.